Hi, my name is Dr. Greg Cason. I have a private practice here in Los Angeles. I have a PhD from the University of Houston. My master's degree is from Cal State Northridge, and my bachelor's degree is from UCLA. You know, each of us has a profession I think that we're called to. Maybe some people don't see it, but some people do. But I think I was called to this profession. And I certainly have seen the power of this field, not only with the people I've worked with, but I think especially even with myself. I've been able to make dramatic changes in my own life just by implementing the very lessons I teach people. I've had an extremely broad experiential base. I've done just about everything you can do in the field when it comes to clinical work. I've worked with many populations, and I've worked with people who are hardcore drug abusers. I've worked in VA hospitals, 2 different VA hospitals. I've worked with schizophrenia, bipolar disorder. I've worked in community clinics, 2 different community clinics. I've sat on boards to help people, boards of different helping organizations. And I've done private practice like I am now. My current private practice I've had for 9 years. I have a significant experience in couple and relationship counseling. About 1/3 of my practice at any one time is couples. And I also do individuals and do something that's different than a lot of psychologists. I do career counseling and work on not only people who are dealing with problems, but also helping people to achieve goals and working on more positive improvements in their life. I think the best way to try to help people is to take a proactive approach and to sit with them and first deal with where they are right now before we delve into the past or worry about the future. I do cognitive behavioral therapy. It's a very special type of therapy. It's present-oriented, it's goal-oriented. We try to help people with what they're dealing with right now and try to help design goals so they can improve in the future. And it is the therapy that has been shown to take people through anxiety, obsessive compulsive disorder, depression, and help them to alleviate those symptoms to be able to lead more productive lives. And CBT goes far beyond dealing with the symptoms. It deals with the very most core issues and beliefs that a person has, and to help them to change their basic lens on the world so they can see the world in a whole different way. I got into psychology because I love this field and I wanted to impact people. And by studying psychology, I actually understood more about how people worked and about how they functioned and how relationship functioned, and I learned about myself in the process. And the study of psychology has been such a positive process for me. It hasn't been just about looking at illness and about how to heal old wounds, but it's also about how to improve one's life. So I've been able to help other people to improve their lives.